Western medicine was not formally introduced into Nigeria until the 1860s, when the Sacred Heart Hospital was established by Roman Catholic missionaries in Abeokuta. Throughout the ensuing colonial period, the religious missions played a major role in the supply of modern healthcare facilities in Nigeria. The Roman Catholic missions predominated, accounting for about 40% of the total number of mission-based hospital beds by 1960. By that time, mission hospitals somewhat exceeded government hospitals in number. 118 mission hospitals compared with 101 government hospitals. By 1954, almost all the hospitals in the midwestern part of the country were operated by Roman Catholic missions. The next largest sponsors of mission hospitals were the Sudan United Mission, which concentrated on Middle Belt areas, and the Sudan Interior Mission, which worked in the northern part of Nigeria. The missions also played an important role in medical training and education, providing training for nurses and paramedical personnel and sponsoring basic education as well as advanced medical training, often in Europe, for many of the first generation of Western-educated Nigerian doctors. In addition, the general education provided by the missions for many Nigerians helped to lay the groundwork for a wider distribution and acceptance of modern medical care. After World War II, partly in response to nationalist agitation, the colonial government tried to extend modern health and education facilities to much of the Nigerian population. Our 10-year health development plan was announced in 1946. The University of Ibadan was founded in 1948. It included the country's first full faculty of medicine and university hospital, still known as University College Hospital, Ibadan. A number of nursing schools were established, as were 2 schools of pharmacy. By 1960, there were 65 government nursing and midwifery training schools. The 1946 health plan established the Ministry of Health to coordinate health services throughout the country, including those provided by the government, private companies, and by the missions. Hence, the nation's healthcare system took off. However, this was not without some hurdles. For example, budgetary provisions were grossly inadequate. Where funds were budgeted for health, they were mostly concentrated in the main cities, with very little for rural health centers. The problems of geographic maldistribution of medical facilities among the regions and of the inadequacy of rural facilities persisted. This singular problem led to lack of access to medical care by those who needed it, especially in the rural areas. The maldistribution of physicians was even more apparent as very few trained doctors were willing to live in the rural areas. Many of the doctors who did work in rural areas were there as part of their required service in the National Youth Service Corps, after which they are gone. Patients frequently did not see a doctor, but nurses or other health workers. Essential drugs were not available at the hospital pharmacies. Those that were available were substandard or fake, leading to treatment failure and most of the time, fatality. The hospital wards were extremely crowded. Beds were in corridors and even consisted of mattresses on the floors. The healthcare system was in chaos with dire consequences. Doctors and health workers' strike kept increasing, leaving less privileged Nigerians to seek alternative healing from herbalists, spiritual healers, and even quacks. The highest level of the Nigerian elite frequently traveled abroad for medical care at the slightest sense of a medical need. That was the story of the Nigerian health system before the current administration of President Goodluck Ebele Jonathan.
My fellow countrymen and women, Nigeria is not just a land of promise. It shall be a nation where positive change will continue to take place for the good of our people. The time for lamentation is over. This is the era of transformation. I will continue to fight for the improved medical care for all of our citizens. Attention will be focused on rebuilding our infrastructure. We will create greater access to quality education and improve health care delivery. I'm confident that we have every reason to look to the future with hope. We owe ourselves and posterity the duty of making this country respectable in the Committee of Nations.
The Federal Ministry of Health has the mandate to promote, formulate, disseminate, lead, implement, monitor, and evaluate health policies of the federal government of Nigeria. In a resolve to change the nation's abysmal health indices and to attain the Millennium Development Goals (MDGs) by 2015 through President Jonathan's transformation agenda, the sector has witnessed remarkable transformation and achievements in the last 3 years in line with the 8 priority areas of the National Strategic Health Development Plan and the National Vision 2020.
At a particular period between 2003 and 2007, that was when we were talking about health reforms in Nigeria. So a number of measures have already been set in motion for the reforms. The things were just beginning to take shape. But Nigeria, like any other country under the United Nations, had a task in terms of the Millennium Development Goals, which is what every country that belongs to the United Nations subscribed to at the turn of the century. And by then we had done almost 10 years out of the 15 years that the Millennium Development Goals were expected to have been achieved. We looked at the maternal mortality rate. We're talking about 545 per 100,000 live births. So quite a huge number of women who were dying from pregnancy-related problems. We looked at under 5 mortality. We're talking about 157 per 1,000. And of course, we still had a national average of HIV then. It was 4.6%. Malaria still remained a burden.
And we have to prepare and plan for this double burden of disease. The implications of these are quite clear, and it has to do with fundamental defects with the health system, which we clearly recognize must be built on a good tripod, with federal leading the role, followed by state and local government. But we know in many of the situations, we have a functional federal system, we have a near functional state system, but we have a local government system that has virtually collapsed. And we now expect teaching hospitals to take care of primary care disorders that ordinarily should not be there. And this is part of the disconnect that we must address in our health system.
If you look at health, everywhere it is the federal government, even at the state level, it's supposed to be the local government, the state government responsibility, and the federal government responsibility. But everybody believes that the federal government only has to do something. That is one of the biggest challenges that we have.
We believe that if we can make things work in Nigeria, then Africa moves.
There was no need to reinvent the wheel. Let's just move forward. Let's take every plan that was already on ground to a logical conclusion. And that was why when I came in, I started the Action Push agenda.
In this documentary series, we examine the progress made so far in the nation's health system. Issues ranging from government interventions in disease control, primary health care development, upgrading of the public hospitals, and building of new ones, as well as special interventions like the open heart surgeries in the University of Nigeria Teaching Hospital, Enugu, the University College Hospital, Ibadan, and the Ahmadu Bello University Teaching Hospital, Zaria, are exceptional achievements of the present administration. Today, no Nigerian needs to go out of the country for major procedures as the open heart surgery.
People are free to choose what they want. I mean, after all, the family can have food in their house, but they may decide to eat out. But that will be the only reason why somebody will be going out of the country to do something like open heart surgery now. Otherwise, here we have all it takes to do at least 90–95% of all the conditions that will require open heart surgery.
People felt it was a status symbol to be treated abroad. I can tell you authoritatively that majority of people who go abroad for what we call cardiovascular diseases. That's diseases of the heart and the lungs. And it's unfortunate that everybody, even with headaches, hernias, go abroad, and it's very embarrassing. The money we are spending on medical tourism is enormous, and it's disheartening that a lot of this money comes from the government.
Those people you are going to meet, you'll be surprised they are your brothers. Some rush to London and you see either a Yoruba man or Igbo man as a doctor consulting. You go back to see your brother in another man's land. But if you put things together here, they will come back and even help you to better what you have. The Indians were before now going to London, America. They've all gone back. The Chinese, the Japanese, they've gone back to their places and developed it. So we need to develop our own.
How are we going to transform Nigeria if we don't invest in Nigeria? If we take all our money out, it won't work. The people will keep going at a faster pace than we could ever. Regarding health in particular, what Nigeria needs is bringing manpower from abroad on the basis of investment in whatever infrastructure we have, so that they can deliver the same quality of service that they are delivering abroad here.
As you would see in our subsequent edition on open heart surgery in Nigeria, the nation is now well positioned to offer specialized medical services that were hitherto obtainable only in India, USA, and countries of Europe. This will no doubt bring succor to many Nigerians suffering from one cardiovascular disease or another, at the same time save the country's foreign exchange.
When people kept also talking about medical tourism and kept challenging us as to what we could do, we now decided to look into it, take it headlong. First, we have signed a number of MOUs with Nigerian health practitioners abroad. You know, they are quite legion, very skilled, very experienced, but due to economic pressures, they had to leave the shores of Nigeria. And then, of course, we challenged our hospitals because I'm a doctor myself, I'm a surgeon myself, and I know there's so much we could do. So we also did something that informed where the problems were. We carried out an audit of our teaching hospitals. We tried to match skills with facilities. Because we do know that in some instances there are facilities, but we don't have skilled manpower. In other instances, we have skilled manpower, but there are no facilities. So in the case of heart surgery, we encouraged the University of Nigeria Teaching Hospital. Now, a number of factors made that possible. One is the push from Mr. President that we should do something to stem the medical tourism. Second is my own conviction as minister that it is indeed possible to reverse the direction of medical tourism.
There is absolutely no facility you cannot find in this country right now, as I'm talking to you. But issue of whether patients can afford those facilities is another story for another day. So we must do something right. Do a medical insurance scheme is something we must address so that people can be insured, and then who can afford to go to and get these facilities done.
As it is now, we've started coverage even for heart diseases to the extent that we have paid for operation of some patients who had open heart surgery in Nigeria. And that's something that I believe is extraordinary, because this is the first time in the history of the scheme that such programs will be covered, such diseases will be covered. We are also extending it even to kidney transplant, to major orthopedic cases, major neurology cases, major cancer cases. All those things are now being covered.
So now, today in Nigeria, we have two hospitals, University of Nigeria Teaching Hospital in Enugu and the University College Hospital in Ibadan, where you can do open heart surgery, where you can do surgery against heart attack or to treat heart attack. So that's a major achievement for this country.
Also worthy of mention is the bone marrow transplant in the University of Benin Teaching Hospital. A service once perceived to be impossible in Black Africa is very much available in Benin, Edo State.
For you to do bone marrow transplant abroad, if you exclude the cost of your transport, the cost of your upkeep, just the procedure itself will not cost you anything less than 12 to 20 million naira. But because it's our own hospital, all together the fees do not go beyond 5 million. However, even 1 million is a lot of money for the majority of Nigerians. So we're still finding ways to see how we can further crash the cost so they can do more. The reason why they've not done so many since the first time they did one is just the cost. Because you must have a minimum of 3 million naira. The rest we give free. Most of the services we're not charging for it, but it's just the cost of the materials. But right now we're exploring things with the University of Benin to see how further we can crash the cost so that more Nigerians will benefit from bone marrow transplant. For now, they are doing it for sickle cell disease, but as you know, bone marrow transplant is also useful for leukemia and some other malignant conditions.
To ensure infrastructure does not pose a challenge to the willing physicians and surgeons, the federal government has embarked on massive infrastructural development in terms of hospital buildings and equipment. For example, the Obafemi Awolowo University Teaching Hospital, Ile-Ife, and the University of Benin Teaching Hospital have been rehabilitated and equipped with state-of-the-art facilities and awaiting presidential inauguration, while Nnamdi Azikiwe University Teaching Hospital and the University of Calabar Teaching Hospital have reached significant stages of completion.
By the time I came in, remember that the previous administration had already started to get back some of our teaching hospitals to what it should be, re-equipping them to standard and so on. And it's still ongoing work, but we have continued with that.
I tell you, our public sector hospitals are working better. They are better equipped. They are embracing PPP partially in some cases, wholly in the case of Garki, and I'm praying for more wholesome PPPs.
A new one-stop ultra-modern hospital has also just been completed at the Federal Medical Center Abakaliki. Also completed and in use is the Federal Medical Center Jabi, Abuja, and many other centers across Nigeria.
If you look at the old setting, the wards are scattered apart, the laboratories scattered apart, the investigative sections like radiology, different. Patients that are very sick, they find it very difficult to access these facilities when they come in. But in a one-stop shop, you just walk in. We have 2 lifts here, the 12 passengers and 8 passengers lift, to help alleviate the difficulties the patients will have. And we also have a ramp to help with the patients if the lifts are so occupied. Then patients should not suffer when they come to hospital. They're already laden with illness, so they don't need to experience any difficulties anymore.
Over the years, we have been improving on the facilities. We are about to enter the third phase. The third phase of the upgrading, we started actually from the administration of President Obasanjo, but President Goodluck Jonathan said we should continue. Another President Goodluck Jonathan, 4 have been completed. The one in Kano has already been commissioned by the President, Aminu Kano Teaching Hospital. The one in Sokoto, Udut Usman Danfodio University Hospital, has also been commissioned by Mr. President. The ones that have been completed, they are in use. We include the University of Abuja Teaching Hospital, Gwagwalada. We include the Abubakar Tafawa Balewa University Teaching Hospital in Bauchi. We include the University of Uyo Teaching Hospital in Uyo. And we include the Irwa Specialist Teaching Hospital, which is in Edo State. So that will complete all the 20 federal-owned teaching hospitals. We're also working on the federal medical centers, but they are not as massive as what we're doing for the teaching hospitals.
In addition, national trauma centers have been established in the University of Abuja Teaching Hospital and the National Hospital Abuja to provide trauma care for those who may have suffered a trauma pain.
There was need to have proper trauma centers. Now, the first of them will soon be commissioned by Mr. President in a few weeks' time, and that's at the National Hospital, Abuja. If you visit there, you'll be proud you're a Nigerian. It's a modern outfit, fit for purpose. It's a proper trauma center. There's another one that's almost nearing completion at the University of Abuja Teaching Hospital in Gwagwalada. And you find at this time they have provisions like the one in National Hospital, helicopters can actually land on the roof. So if people evacuated with helicopters, they can actually be brought in straight there. And from there, they will take care of them. Then we also give special support to our orthopedic hospitals to improve their capacity for trauma. That we've also done. Then we're working with the Federal Road Safety Corps And now I've also set a committee with the Secretariat at the Federal Road Safety Committee, but Minister of Health is chairman, how we can collect data. Data is important to know what is the burden and also to plan. So now we are putting things in place. Very soon we'll come out with a policy, how everybody, even private sector, state governments, voluntary agencies can buy into it. Then we'll be able to coordinate as them. But I must also give kudos to the Federal Road Safety Corps. So much they've done to improve things like having a toll-free emergency number, which we all know, 122. Just call it anytime. They'll be able to go for rescue.
Besides, the federal government has signed a Memorandum of Understanding with General Electric (GE) for the establishment of private world-class specialist hospitals and diagnostic centers under Public-Private Partnership (PPP) arrangement. This partnership was also to provide required world-class equipment and facilities that would aid patient treatment and reduce preventable deaths. In the wake of the transformation agenda of President Goodluck Jonathan, the health sector has been repositioned to provide quality health care for Nigerians through adequate budgeting in line with international best practices. On disease control and prevention, Mr. President has doubled the funding for polio eradication activities to 4.7 billion naira, and to ensure that this fund is judiciously used, a presidential task force on polio eradication has been set up under the chairmanship of the Honorable Minister of State for Health.
Nigeria has made unprecedented and tremendous progress in poliomyelitis eradication, with only 3 cases reported this year, representing about 96% reduction in the burden of wild polio virus in Nigeria. The country is therefore on the verge of historic achievement of eradicating polio in the country.
The polio story in the last 2 to 3 years would make an unprecedented progress that has never been seen in the history of public health. And we've also brought into public health what is known as a global best practice in terms of program management. Polio will be the next disease that will be eradicated within the administration of Professor Onyibuchi Chukwu. You remember that we received the Guinea worm eradication certificate. So the next one will be polio because the signs are there.
Also, a new polio eradication emergency plan has been developed with an accountability framework. The government has also continued to engage critical stakeholders such as the Nigerian Governors Forum, Northern Governors Forum, and the Traditional Leaders Platform to secure maximum support, buy-in and goodwill to ensure the success of the presidential agenda on polio eradication and primary health care in Nigeria.
Let me assure this global gathering and indeed the whole Nigerians that the federal government has the total commitment to ensure that we eradicate polio. Promise and work hard towards it. We didn't want to hand over polio to another government in 2015.
Nigeria's routine immunization, which is the most fundamental to the success of any child survival interventions on public health, stood at a mere 43%. With current leadership of the Ministry of Health, Nigerians' coverage of routine immunization now stands at over 83% coverage. This is a major achievement already acknowledged by the international community.
We still have some states and certainly some LGAs that don't pick the best vaccinators, that don't release the money on time, that don't run a campaign that everybody knows about or follow up on the kids who don't get covered. And so the task force needs to track these gaps. We need to look at the numbers like we are here today on a regular basis, and we can cast a strong light on those who need to do better. By helping them, we'll make sure that they do their job, and the country will move ahead in a very exciting way by finishing off polio.
In 2011, the country introduced the new cerebrospinal meningitis vaccines, which confers protection for at least 10 years as against 3 years with the previous vaccines. As a result, the country has not experienced any epidemic of meningitis till date. Also, as part of measures to reduce infant mortality in Nigeria, the federal government introduced pentavalent vaccines to help protect children against childhood pneumonia and hepatitis B. What's more, HIV and AIDS services are being decentralized and integrated into primary healthcare services at the grassroots level. The singular initiative seeks to increase the prevention of mother-to-child transmission from current rate of 20% to 80% at full implementation.
The integration of HIV to other things that has helped to build a health system. The health system has improved, the community system has improved. When you put all these things together, it has helped indeed to make HIV, what it is today. For us to say we have moved from a death sentence to say, when are we going to end AIDS? So that's the story of perhaps some of the reasons behind, this progress.
In Nigeria, we are firmly committed to halting and reversing the spread of HIV and AIDS, consistent with the UN Declaration for Achieving Universal Access to Comprehensive Prevention, Treatment, Care, and Support. Considering the need to accelerate improvement, we have introduced an innovative strategy that places emphasis on integrated services at the local level. This means that the existing parallel system in healthcare delivery is now being integrated into the National Health Program using the primary healthcare approach.
For the first time in Nigeria's history, the international community has evidently acknowledged the nation's amazing drive towards reducing the spread of HIV/AIDS in Nigeria. So much has been achieved in the nation's health sector under the present administration of Goodluck Jonathan. Join us next week as we take another look at Nigeria's health sector in perspective. See you then.